Hi, I'm Amy Johnston. Thanks for joining me as we learn more about weight loss surgery and your options for a healthier lifestyle. Located in Austin, Texas, the Bariatric Center at St. David's Medical Center has been named a comprehensive center by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This designation, supported by both the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery, works to advance safe, high-quality care for bariatric surgical patients. During this online seminar, you'll learn about different weight loss procedures and how to determine which might be the best for you. You'll also hear from nurses and a dietitian about the support you can expect to receive before and after surgery. And finally, you'll hear from real-life patients who are sharing their personal journeys with us. And if you should decide that weight loss surgery is for you, we'll walk you through the next steps. First, let's discuss who qualifies for bariatric surgery. Who is the best fit for this kind of surgery? Allow me to introduce Dr. Tim Falkenberry. He is the Medical Director of the Bariatric Center here at St. David's Medical Center. Thank you for joining us.
My pleasure.
Let's start right with defining obesity. What is obesity?
Obesity is the carrying of fat, adipose tissue on the body that is in an excess amount. People who have morbid obesity, really the people that should consider surgery, are folks that have obesity that is now reached a level to where it's actually contributing to or really outright causing medical illness.
Well, let's talk about BMI. What is BMI specifically?
BMI is body mass index. It's a calculation of height compared to weight. It's a very common measurement that's used nowadays. We know that a BMI of 25 or less is in an ideal weight category. A BMI of 25 to 30 is now overweight. 30 to 35 BMI gets into the obese category, and then a BMI of 35 to 40 is going to be in a morbidly obese category, a condition where those medical issues such as diabetes or high blood pressure or joint pain are actually being made worse by the level of fat that the person is carrying on their body.
So who is this type of weight loss treatment for?
A person who is significantly overweight almost always has made efforts to try to lose weight. They've done adaptations to their lifestyle. They may have been able to make effective changes in their diet and exercise more, and yet in spite of those efforts, still have been unable to lose weight. The body actually gets to where it gets used to being significantly overweight. It becomes very difficult for them to lose weight successfully. And for those people, surgery may be an option.
Well, let's talk about some of those implications, the health implications with being obese. What are they?
We know that obesity causes many medical problems, metabolic type problems in the body. The most common ones probably are high blood pressure and diabetes, type 2 diabetes. Those conditions become very difficult to treat as there's more excess fat on the body. There are actually chemical processes that go on from being significantly overweight that make it very difficult to control some of those issues. And then in addition, there may be risk of stroke, risk of heart failure, certainly joint pain. You can imagine that people that carry around a lot of excess weight are going to have knee pain, hip pain, back pain is so common. Those conditions, there is no treatment for it that's going to be significant except getting rid of some of that weight.
Now, what are some of the trends with obesity you've seen through the years?
We have seen an alarming increase in the amount of obesity in our country over the last 2 decades. An increase in obesity in the adolescents. We now know that 1/3 of adolescent teenagers are obese.
1/3.
1/3. It's a very alarming statistic. And so what we need to do is to make as much effort as we can to try to correct that problem, or else once they have gotten into that condition and they become adults, we want to try to do something to help them to control their weight, to lose weight, so that they can go on and live a healthy life.
Now, there are a couple of procedures out there. Can you walk us through them, each one of them thoroughly?
The most common procedure nowadays is sleeve gastrectomy, vertical sleeve gastrectomy. It's an operation that's done laparoscopically. Most all the operations done nowadays are done laparoscopically. The sleeve gastrectomy removes a substantial portion of the stomach, leaving a long, skinny tube of stomach, the sleeve of the stomach. This operation is very good at controlling appetite and the amount of food that it takes to satisfy appetite. And as a result, the weight loss with this operation has been so good that it has climbed to the top of popularity in just a matter of a few years. It's very successful.
And another option would be a gastric bypass.
Correct. The gastric bypass is still considered the gold standard operation. It is an operation that combines both bypassing a portion of the stomach as well as a portion of the small intestine. It is the most powerful operation that we have for difficult to control metabolic issues such as diabetes and high blood pressure, and it's still the best choice for some patients. Both the sleeve gastrectomy and the gastric bypass operation are very effective at weight loss.
Are there any other options?
Yes, the adjustable gastric band is a procedure that is designed to control appetite and control the amount that a person eats. The success of that procedure is pretty good for some patients and select patients. It is a procedure where an adjustable silastic device is put around the upper portion of the stomach, and a port is placed under the skin on the abdominal wall to make adjustments in how tight that band is around the stomach.
And what can successful weight loss achieve?
Well, we know that weight loss, of course, everybody wants to focus on how many pounds they're going to lose. That's not the only thing that is a measure of success. The measure of success that we emphasize is that if you take less medicine, your medical conditions come under control, your joints hurt less, you're there to be with your children or your grandchildren, you can count on that. You're not so worried about are you going to be continuing on the path of immobility, which many patients are. They get to where they have difficulty to get around. Lose some of that weight, you maintain weight loss, your lifestyle improves. That's really the measurement of success.
You know, for people watching at home, statistics show they are not alone in this weight loss battle. Can you give us a glimpse at some of those patient statistics?
Well, we know that, we just mentioning earlier that the trend in the last 20 years has been really alarming. And the amount of obesity that has been recorded by the CDC, the Center for Disease Control, showed that in 1990, we had a moderate amount of obesity in the United States. Within the next 20 years, we have more than double the number of obese folks in the United States. And in the South, where we're included, of course, the amount of obesity is astounding. We have more than a third of the adult population is morbidly obese.
It's stunning numbers. Well, thank you very much for joining us. We appreciate it.
I appreciate it.
Well, as Dr. Falkenberry said, you are not alone in your journey to a healthy weight. An estimated 18 million plus adults could qualify for weight loss surgery each year. Which option is best for you? Hillary underwent surgery at St. David's Medical Center in 2011. It was a decision that continues to have a lasting impact on her health and overall well-being. Take a look.
I think being active is really important for fitness and mental health. So I do walk my dog fairly often when I am not traveling for work. And I also swim and do yoga fairly often as well. Being in a normal-ish weight is just really helpful from a lack of pain standpoint. And my knees and feet used to hurt a lot when just walking, and that's not the case anymore. So I think having less weight makes being active actually easier. My name is Hillary, and I had the vertical sleeve surgery in 2011 with Dr. Falkenberry. So I've always been a pretty big person, both tall and not particularly thin from an early age. And through junior high and high school, I played volleyball and basketball and was never thin but was fit. And then moving into college, I played horse polo, which kept me fit as well. But then when I moved into graduate school, it was just so much focus on the work that I became fairly sedentary and got married and was sort of blissful in that period and put on 100 pounds over 3 or 4 years, which just wasn't very comfortable physically. That's how I sort of came to the weight loss surgery decision.
Folks that are considering weight loss surgery have several different options that are available today. Surgically, we are very commonly recommending sleeve gastrectomy, which is now the most popular operation in the United States. The adjustable bands are not as popular as they once were. They are certainly okay for a select number of patients. And still, I think the gold standard for maximum control of metabolic issues as well as weight loss is still gastric bypass. Once a patient has decided that surgery is maybe the thing for them, what they need to do is to call the Bariatric Center or email them, and they will then begin the process of getting the patient lined up with a surgeon, giving them opportunities for choices, and move them along the path that's ultimately going to get them to the operating room and to a life that's going to be different.
I lost maybe 10 pounds the first week after the water weight of surgery came off. And then after that, it's a few pounds a week for as long as you are strictly following the diet. And the longer you can strictly follow the diet, the better I think your long-term success will be.
Everyone is really anxious for the results to show, and for most people, it is very important. It's imperative to follow their instructions about diet, about portion sizes, about drinking and eating, separating those. Very important to follow all of those directions. It's been designed, it's been proven to work, that if folks will be very compliant and very attentive, their opportunity to maximize their weight loss is very real.
I think it can, enable other people really to have whole lifestyle makeovers who maybe felt held back by their weight. And when they shed that weight, then they feel empowered to be more confident, both in their personal and professional relationships.
Wow, so amazing to see the change. She looks great and feels even better. Joining me now is Carrie Lynn, the nurse manager here at the Bariatric Center at St. David's. You're going to walk us through the surgery process, right? What can people expect in the beginning?
The very first thing that somebody needs to do when they decide to have weight loss surgery is choose a surgeon, and that they can go about that process many ways. Some people know a family or a friend who's had surgery with somebody. There's a few places you can look online to look up at surgeons and see who you're comfortable with. Sometimes it's as easy as whose office is close to where you live or to where you work. Once you've established who your surgeon's going to be, they have a really great system set up where there's going to be somebody who helps you with the insurance process. We could have the same insurance. We could both have the same company covering our insurance, but we could have vastly different policies. So it's really a good thing that somebody can look up and tell you, this is what your insurance covers. This is what you can expect for out-of-pocket expenses. And these are the things that you need to do to qualify through your insurance. It's also important if you're going to be a self-pay patient that you know what to expect as far as pricing, and there's going to be people who can walk you through that as well.
What kind of support can people get before the surgery?
We don't expect our patients to be experts on figuring out how to maneuver the medical system. So there's going to be somebody who's telling you this is what you do next. They're going to be checking in on the paperwork that you've gotten finished. They're going to be making sure that everything is meeting the requirements that you need it to meet for your insurance or for your surgeon. And they're going to be making sure that you get from point A, which is that very first appointment with your surgeon, to point B, which is leaving the hospital healthy. We're going to be there every step of the way.
If someone's watching today, what are the next steps that they need to be taking?
Finishing this seminar is absolutely the first thing they need to do. And after this seminar is finished, one of our staff members at the Bariatric Center at St. David's, we're going to reach out by phone and talk you through the next steps, make sure you know what to do next.
And make sure they have all the answers.
Absolutely.
All right, thank you, Carrie, appreciate it.
Thank you.
That is just what our next patient, Gary, did. Gary reached out to St. David's Bariatric Center. Just over a year later, he has achieved life-changing results and continues to turn to St. David's for support. Here's his story.
I think the thing that I would emphasize is how much additional stamina that I have, how much I have of love of life, where in the past it was sometimes a dreaded thing to get out of bed or to walk up a flight of stairs or to go out for a simple walk in the neighborhood. My name's Gary. I had gastric bypass surgery on August 11th of 2014. I had the surgery on a Monday, and I was out of the hospital within about 3 or 4 days. There was some pain, associated with it, not as much as I thought there would be. They had me up and walking rather quickly. The nurses and the doctors at St. David's were great.
Every patient that has surgery, of course, is going to expect that there will be some discomfort associated with it. However, since all of the operations that are done nowadays, for the most part, are laparoscopic, the recovery is fairly rapid, and the discomfort associated with it is modest in comparison to many other operations.
After that, I was able to come home and recuperate at home, and within probably 2 weeks, all the pain had pretty much gone away, and then it was just a matter of following the routine that they give you as far as diet and exercise.
Once a patient has had weight loss surgery, there is a lot that's going to be going on that's going to be different. Their diet is, of course, going to be monitored and regulated for the first several weeks as they go through the recovery process and moving from liquids to soft to regular solid foods. The diet, for the most part, is not special foods, just quality foods. And they'll be instructed about eating much smaller portions, eating more slowly, chewing very carefully.
Here we go. All right.
There is going to be collaboration between the Bariatric Center here at St. David's Medical Center and the surgeon's office. There'll be dietitians, nurses, folks who will be able to answer questions and direct patients in the right direction, perhaps to suggest support groups. Support groups are very helpful to many patients.
It made me feel much better about everything. So by the time it was time to do the surgery, I was feeling comfortable with the whole situation, and I didn't have the nerves that I think I would have had I not had the education that came out of the support group. And the support group was great for doing that, and I commend them in St. David's for putting together those support groups, and I still continue to go to them from time to time.
As the weight begins to come off, a patient who may previously have been limited in exercise will be able to do much more exercise, and it's important to take advantage of that.
I try to walk at least a mile, sometimes 2 miles a day at a reasonably fast pace, not tremendously fast, but reasonably fast, to burn the calories up.
It helps their joints, it helps their heart, it helps their back, and in general, as patients feel better, they ought to do better. Many patients go into weight loss surgery thinking that their only measurement of success is going to be the amount of weight that they lose. But we encourage people to do their absolute best to maximize whatever they can do, and to really look at how much their life changes in other ways as well.
I feel great. I have stamina that I never had before. Prior to surgery, I had diabetes that I was taking insulin for. I had high blood pressure. I have neither of those now. Life-changing event, that's for sure.
Now, Gary talked about the importance of support. Joining me now is Valerie Castro, registered dietitian, and Merritt Manuel, a registered nurse at the Bariatric Center. Thank you for being here. First, let's talk about why it's so crucial to have a support system throughout this journey.
This is a life-altering surgery. A lot of big changes have to be made, and it's really important for patients to have that support.
We start the support process off with us at the Bariatric Center. Then it kind of follows to the primary caregivers at the hospital, and then we definitely like to extend it into the patient's family and friends. In order to be successful in their goals, they need to have that support. We also do support groups here at St. David's, which are great for patients to come and meet each other, to kind of talk about the challenges, the pitfalls, the achievements that each other have made. We're also at each support group, and so it's a great way for us to see patients face to face and to help them along the journey as well.
And Gary talked about the responsibility that he takes. Can you kind of walk us through some of the dietary changes that will happen?
Yes, after surgery, patients are going to be first placed on a liquid diet for a few weeks. After that, we'll progress them to a puree diet, which consists of food of applesauce or baby food consistency. Followed by that are going to be our soft foods, and eventually they will get to regular consistency foods.
And this is where portion control comes in?
Yes.
All right, you've brought some examples. Can you show them to us?
Yes, this plate over here represents the recommended servings of someone preoperatively, or you and I. And this plate represents portions that are recommended post-surgery once patients are on the regular consistency phase.
You know, I look at that and that's a pretty radical difference. How do they do?
Well, the appetite is so well controlled after surgery that patients are satisfied with these portions.
So, have you seen cases where a patient may plateau or even fall behind on their goals?
Plateaus and weight regain can happen. Initially, patients are really excited to see the results on the scale, but then sometimes they forget to continue the recommendations set forth by their surgeon's office, such as appropriate calorie intake, protein intake, their vitamins and supplements.
So Valerie, when that happens, how do you get them back on track?
First of all, we want them to start food journaling. We want them to ensure that they're taking the appropriate recommended calories, protein, multiple vitamin mineral supplements recommended by their surgeon's office, because a lot of times out of sight, out of mind. If you're not documenting, you're not exactly sure what you're actually ingesting.
Yeah, so true. Now, Merritt, it hasn't been too long since Gary had his surgery. Are the staff at the Bariatric Center available long-term?
Definitely. We give all our patients phone numbers, contact information, so at any point along their journey they need anything, we're here for them. You know, because their questions are going to be different at 2 weeks post-op, 2 months post-op, 2 years, so we're always available. I think that's what makes St. David's a really great program, is because we're here with you every step of the journey.
All right. Thank you, ladies, for being here. For more frequently asked questions like, will insurance help pay for this procedure, and will I be able to get pregnant after weight loss surgery, please click on our FAQ page at stdavidsweightloss.com. Once you've completed watching the seminar, please provide your information, and a member of the Bariatric Center will be happy to contact you. As we've learned today, the staff here is eager to help you navigate your journey to healthy and long-lasting weight loss. Thank you for joining us today. We look forward to helping your weight loss journey here at the Bariatric Center at St. David's Medical Center.